So welcome back guys. In this particular session we'll be talking about the health planning and the management. So if you will look at this term health planning and management, so there are two terms important, planning and management. So if you are thinking generally, what is planning guys? You are planning for something, right? Let's say you are planning for giving an exam, or you are planning for sitting in an exam, right? And you are planning to clear that exam. So in this planning you will be needing a lot of thought process, right? And you will be needing a plan. Why we are calling this a plan? Because there should be something, right, which is achievable and which is reasonable, right? So there could be different plan for different students to clear some particular exam, right? So if you talk about the FMGE exam, let's say, there could be different strategies, there could be different plans for n number of students, right? If there are 100 students, there could be different strategies for them, but at last they need to study. That is common. So over here we are talking about the planning. So planning is like we are preparing for something, and then management is like we are executing that. For example, planning, what they are saying, planning is like defining an organized, conscious and continual attempt, right? It is an organized, conscious and the continual attempt. Select the best available alternative to achieve the specific goal, right? So we are having the goal. For example, you are having a goal to clear some exam, right? And for that you are planning, right? So that is called as planning. What is the management? Management is like act of securing maximum result and minimum effort, right? So you want the maximum result by putting the minimum effort to achieve maximum prosperity and happiness and give public the best service, right? So here basically one thing is there that we are having a plan. Now second thing comes to execute the plan. It's not that you made your timetable and after making the timetable you just stick on the wall and then you forget about it. Like that things don't work, and we know that, right? If you're thinking you're making a plan that I will be studying 6 to 8 hours in tomorrow, let's say, and if you're not studying it, obviously there is no use of making your plan, right? So first step is to make the plan, right? You are making your study plan, for example, right? You made your plan. Now the plans might be for a longer term, the plans might be for the shorter term. So in the night you might be planning your day like, tomorrow I will be doing this, I will be completing that chapter, this chapter. Okay, I'll be studying for this many hours. At this point of time, I'll be taking the break, and all of that. You are planning right now, right? And tomorrow, if you are doing the things in same manner, yes, plus or minus could be there, but if you are trying to do that, that is called as execution. That is called as the management over there. So health. So that's how, in terms of health, also we are talking about the health planning and management, right? So here, if we talk about the planning, guys, right? We are having some planning. So planning is a blueprint for taking the action. First of all, you should have plan, right? And then you will be executing your plan. If you don't have the plan, then what will you execute? So in the plan, this is a blueprint for taking some action, right? So you can actually correlate this to your studies, right? So over here, if we talk about the steps of planning, guys, we are having several steps. For example, we shall be talking about the analysis of the health situation, right? Identifying the health problem. So firstly, we are analyzing the health situation. What is happening in the health situation? For example, if you are a health minister, government of India will be asking you that what could be the things which we can do for our population to make our health system better. So what you will be doing, you will be analyzing the health situation. So at present, what is the health situation and how you can make it better. So analysis of health situation is there. Identifying the health problems now, right? What are the major problems which are circulating in our population? Formulating the goals and objectives. So we will be making the goals, right? We'll talk about what is goal, what is objective, what is target. We'll talk about that, don't worry. Assessment of the resources, right? Whatever the resources are there, we'll be trying to assess them. Selection of the priorities. For example, this many people are developing with the lethal diseases, so we'll be focusing on that thing. For example, the COVID wave came, so the primary focus was to treat the COVID, was to prevent the COVID in the community, right? Or in the society and all of these things in the population, right? So we saw that the doctors from different branches, right, they were ordered to serve their service for the COVID only. Dermatologists were serving the COVID people, psychiatrists were serving the COVID people, right? The surgeon was treating the COVID people, right? So what was the thing over here? Because that was a mass problem in front of us. So almost every hospital became the COVID hospital except few, right? So that is the thing over here. We need to select the priorities, write up the formulated plan. We should be having the plan accordingly, programming and the implementation, and then at last monitoring and the evaluation, right? So these are the steps which are very important, which you need to remember about the planning. Once you are having planning, execution, that's the management part. So in the management, how the management functions over here, the planning, organizing, staffing, directing and the controlling it, right? These are the management part over there. right? So planning is there, management is there. Now, what about the objective, target and goals? What are the objectives, what are the targets and what are the goals, right? Very important, guys. So, think like this. You will be understanding it very easily. Objective is a short-term thing, right? Objective is a planned and endpoint of all activities. What they are saying is that objective is a short-term thing, right? That I am having the objective right now to study, right, and to pass this exam. Let's say, right? For example, you are studying for your FMGE exam, right? Now, what you will be thinking? You're studying for your FMGE exam. What you are thinking? That I should be clearing this exam, right? So, what is your objective right now? I want to clear the FMGE exam, right? Now, if you talk about the target, guys, right? Now, after clearing the FMGE exam, I will be going to the hospital, I will be seeing the cases and all of these things, right? And I will be feeling the happiness about that. That could be your target, right? Or your target would be that after clearing the FMGE, then I will be looking for the higher studies. That could be your target, right? And at last, what could be your goal? Your goal is at last, being happy, right? Your goal could be, achieving your dreams, fulfilling your dreams, right? All of these things. And usually the goals are not achievable, or very few people are there who will be able to fulfill their goals. For example, you are thinking to have a big car, big house, right? And you are thinking of a good high salaried job or having the big business and all of these things. You are thinking of, you're dreaming of opening up your own hospital and all of these things. These can be the goals. These can be the desired the desired goals, right? But goals are usually not achievable. So these are the long-term goals, right? If you are thinking to opening up your hospital, for an example, or you want to visit every country in this world, so this could be the goal, right? This is not happening. This is not going to happen tomorrow or next year, isn't it? So basically, first of all, you need to complete your studies, and you need to build up your system and all of these things. And at last, you might be thinking of at the time of like after completing all this process. At that point of time, you might be thinking of fulfilling your dream and all of those things, right? So if you talk about objective, it is a very short term thing. Target, it is a mid-term thing, mid-term milestone, and goal is a very long-term thing, right? So basically, if you talk about the objective, this is the planned end point of all activities. So target, if you talk about, target means refers to a discrete activity. It permits the concept of degree of achievement. Basically, they want to say that it is a short-term, objective is a short-term, it is a short-term thing. Target, if you talk about, it is a mid-term milestone, it is a mid-term milestone, right? And if you talk about the goals are the long-term thing, right? These are the long-term milestones. Okay, these are the goals. So goals are the ultimate desired state towards which objective and resources are directed, right? So I am working now for, you are working now today for your better future, right? You are working for your objective right now. And you know that if the objective will be fulfilled, then my target will be fulfilled. If my target will be fulfilled, my goal will be fulfilled. So my objective and target, right, is for my goal, isn't it? So that is the thing over here. Fine. Now objectives are concerned directly with the problems itself, but targets with the factors in the problem, right? I mean, the objective is a short term, then target is a mid term, and the long term is the goal. That's how you can remember. Now, what could be the difference between the goal and the objective, right? If you talk about the goal over here, the direction and the overall, they are just taking the example, right? So goal, I told you, this is a long-term thing. Objective is a short-term thing, right? So goal that, I want to be successful, right? This could be a goal. I want to settle in some big country, right? I should be having the hospital. I should be having so many things. I should be having a bigger car, house, and all of these things you might have dreamed. This could be your goal, right? And objective means I want to complete this chapter, right? I want to clear this exam. This could be your objective right now, right? Specificity, general intention or direction, right? And objective are very specific and the precise, basically. That is, if you talk about the objective, right? Objective, basically, that is narrow in scope. And plan, if you talk about the goal, then it is the broader in scope. Obviously, that's the broader. Size, obviously the goal will be larger in size and objective will be the smaller chunk. For example, I want to finish this particular chapter, then tomorrow I will be finishing that chapter. So small things you are taking. You are not thinking that today I will complete this subject and tomorrow I will complete this subject, day after tomorrow I will complete that subject. That's not possible, right? Okay, so obviously we need to give some time to the chapter. We can say that yes, I will be completing 2-3 chapters of this one, 2-3 chapters of that one. That you can plan, but you can't say that I will be completing this subject today and I will be completing that subject tomorrow. That is not possible. So if you talk about the objective, you're talking about the shorter thing, shorter chunks, right? That is the thing, right? Then general outcome is there in the goal, and specific actions and measurable specific steps in the category of objective. Example, they are taking the increased international customer base, and over here, if you're working as a businessman, if you're working in the company CEO, as a company CEO, then you are talking about the different goals and objectives, right? Measurement, they are difficult, right? Goals are usually intangible. They may not be strictly measurable, right? They might not be followed by everyone, right? Everyone is not Elon Musk, right? Everyone is not a successful person. It might be in the different fields, right? So that is the thing over here. So goals are something which we are desired of, but if we are working at our objective and a target in a right manner, in a specific manner, in a disciplined manner, then probably we might be achieving our goal, right? So that is the thing. So objectives are usually easy. It must be measurable and tangible. Why is it easy? Because usually you might be thinking, because for the goal you should be disciplined for very long period of time. For objective you should be disciplined for very less period of time, right? If you want to complete 2 chapters, you just need to be disciplined for 2 to 3 years. If you will be sitting and studying, and probably you might be finishing them off, isn't it? If you'll be studying for some exam 3 to 4 months, then you might be clearing that off. Your chances of, your probability of clearing the exams are very, very high in that case, isn't it? So it is achievable. But if somebody will be asking you, you have to study whole year, 1 to 2 years you have to study for this particular exam, right? Or you don't know anything about some other exam, right? And you have to study for this exam 2 to 3 years with high intensity, right? So how many people will be able to clear that exam? Obviously very few people will be coming out of it. So that is the thing. So objective is for short thing and goal is for longer term, right? So goal is for longer term, objective is for medium to short term, right? Okay, once we have talked about that, now we shall be talking about the important health committees, right? Important health committees. So, from the history, we are having several committees. We'll be talking about that. So, first of all, there was Bohr committee, which came in the 1946. Then there was Mudaliar committee, that was in the 1962, that came into 1962. Then Chadda committee came in 1963. Mukherjee committee, then that came in 1965. In 1965 to 1966, that was the Mukherjee committee. Jangalwala committee, that came in 1967. Kartar Singh committee, that came in 1973. Srivastav committee, that came in 1975, and then rural health scheme, that was in 1977. Bajaj committee, who was a businessman, 1986, and national health policy, which is a 5-year plan, introduced in 2002, right? And from the national health policy, the question might be coming like, what is the health planning in India? According to the national health policy 2022, we are talking about the health planning in India. So here the government of India set up a planning commission in 1952 and started the 5-year plan system, right? 5-year plan system for what? Socio-economic development of the country. So they introduced a 5-year plan. So what is the 5-year plan? So who is the chairman usually? Who is the chairman? PM is the chairman, right? Obviously the party changes and all, so whoever will be the PM will be the chairman of this commission. So 11th 5-year plan was, came in the 2007 to 2012, and 12th 5-year plan, it came in 2012 to 2017, right? So this is a 5-year plan which was for the development of the socio-economic status of the country. PM is the commission for this particular health plan, right? Health planning in India, right? Okay, this is a 5-year plan. So what are the goals? What are the goals of planning? Goals of planning are central level, state level, and district level, obviously, right? Central level is a bigger level, right? Under the central, central government, under the center, like you are talking about the national level. Under the national level, you are having the state levels, right? There's a state government, different state governments, different parties could be there, right? Different chief minister from several parties could be there. So if we talk about this, then we might be having the, central level, state level, and district level. At the level of center, we are talking about to increase the number of CHC, right? By 2015, to increase the number of ANM to 25,000 by 2010, right? So they want to increase the capacity at the center level, if you talk about, right? This is the level of planning. Prioritization of the district needed, right? Over there. If you talk, right, that about central level. About the state level, if you talk about, prioritization of the districts are needed. Additional resources are needed, like you need to increase the, ANM, doctors and the male health workers, so that you might be able to reduce the burden from the older doctors and the nurses and whatever staff is there, right? District level, which PHC needs support, right? You need to decide which sub-center does not have an ANM posted and all, right? There are many centers, centers are usually district, if you talk about district level, below the district level, there are CHCs, PHCs, right? Sub-centers and all of those things. So over there, many of the vacancies are still vacant, right? Over there, there could be the vacancy of ANM, but nobody is there, right? So all of these things we need to look upon, and whatever vacancies are there, we need to fill them up, right? So that the healthcare system is getting the strength. So which PSC needs support and which sub-center is needing some kind of staff nurse or the A&M nurse or something like that, right? If in the CHC some doctors are lacking, then we need to fill up the vacancies for the doctors as well, so that proper care should be given to the population or the community. So that is talking about the level of planning, right? Now, so we have talked about the very first committee, that was the Bohr committee, right? In the Bohr committee, we are talking about that it was adopted in the 1943 by the Bohr and recommended comprehensive and the remodeling of the health services. Basically, they talked about some of the salient features I am talking about over here. So they have talked about the integration of the preventive and the curative health services at all levels, right? So prevention and the curative services, they have integrated that at all levels, right? So hospital-based healthcare system should be there. Development of the PHC in the 2 stages, primary health centers in the 2 stages. Training in the PSM for the doctors, preventive and social medicine. The doctor should be going to the rural health postings and all. A PHC for every 40,000 population. A PHC for every 40,000 population should be there. In the PHC, there should be 2 doctors. There should be 4 nurses present over there, right? The 4 midwife should be there. 1 nurse and others should be present over there. If you talk about the longer term plan, then primary health unit for every 10 to 10,000 population should be having the 75 beds. Secretary unit with 650 bed hospital and district unit with the 2500 bedded hospital. So all of those things came into the Bohr committee, right? Then we came up with the Muller committee, which was introduced in the 1962, right? So it was about the strengthening the PHC level, right? PHC level is working at the rural level, guys, right? PHC is actually working at the rural level. I have talked about that in the healthcare system of India. So it is actually talking about the PHC before establishing the new one, right? Strengthen the PHC. So PHC should be providing the preventive and the promotive and the curative services to the community. Strengthen the subdivisional and the district hospital. So it is talking about the strengthening the several level of caregivers, for example, PHC, CHC, district hospitals and all of these things, right? So creation of All India Health Services. Now, then came the Chadha Committee, which was in 1963. After the Muller Committee, in the 1963, they came up with the Chadha Committee, right? And Chadha Committee, according to the Chadha Committee in the 1963, they had talked about the malaria worker to function as a multi-purpose worker, right? So initially, the malaria worker was separate and the multi-purpose worker was separate. And they came up with the committee, that there is a Chadha committee. They said that malaria worker and the multi-purpose worker, they will be working together. So there should be one worker only. Okay, so they merged that. So they talked about malaria worker, right? Malaria worker, right? And the multi-purpose worker, right? They should come together and they should be having only one worker should be there. Only one worker should be there. So they talked about the merging. They talked about the merging over here, right? They talked about the merging, right? But then, Mukherjee committee came. Mukherjee came in the 1965, right? That Chadha committee came in 1963 and Mukherjee came in 1965, right? He said that, we need to separate the staff for family planning program. Otherwise, both the programs will be disturbed, right? We'll not be able to treat the malaria people also, and we'll not be able to work at the level of multi-purpose workers. So we should separate them. So they talked about the delinking now. They talked about the delinking. They said that no, actually we need to look for the delinking. Let it be separate only. Let the multi-purpose worker do his work, and let the malaria worker do its own work, so that we are having a separate things over here. Otherwise, our system might be collapsing. So over here they said that malaria activities to be delinked from the family planning activities. So Chadha committee talked about the merging of malaria worker and the multi-purpose worker together. And then Mukherjee committee came. Mukherjee said, no sir, we need to delink this. So malaria worker will be working separately and the multi-purpose worker will be separating. So they talked about the delinking. They talked about the delinking, right? Okay. Then we had the Jangalwala committee in the 1967, which came over there. Jangalwala committee said that there should be a unified approach for all the problems, right? Instead of having the segmented approach, we should be having the unified approach for different problems, right? That would be better for us. And they talked about the medical care and the public health programs to be put under the charge of the single administration only, right? So there should be a Indian Administrative Services, and that will be handling the medical care and public health program, right? So they should be handled under one care only. That was given by the Jangalwala committee, right? So they talked about the Indian Administrative Services, and it should be coming under the Indian Administrative Services, so that there is one system under which the healthcare system will be working, medical care system and the public health programs, right? Okay, then came up with the Then we came up with the Kartar Singh committee. Then Kartar Singh committee came and they talked about the concept of multipurpose worker male and multipurpose worker female. So multipurpose worker is also should be having the two categories over here according to the genders. One should be the male, one should be the female, right? So we are calling that. So one PHC to cater around 50,000 population. Like one village is catering about 1,000 population. Like one PHC should be catering around 50,000 population. So how many villages? 50 villages, right? How many villages? 50 villages. So one PHC should be catering around 50 villages over here. Each PHC should be having the 16, SHC over here, 3 to 3.5 thousand population will be catering them. So then we came up with the Srivastav committee. And Srivastav committee was talking about creation of bonds of the para-professional and the semi-professional health workers, right? Para-professional, semi-professional health workers from within the community itself, right? In the community only, we will be, choosing the para-professional and the semi-professional worker over there, and they might be working for the development of referral services complex. So that was coming under the which committee? That was the Srivastav committee, right? So usually nowadays the questions are not coming from the committee side, but still it is a historic movement. So probably the question might be coming from the demerging and the merging of multipurpose worker with the malaria worker. So over there you should know about the Chadda committee and the Mukherjee committee, right? And what are the feature of just one point you shall remember for the like Kartar Singh committee talked about the multipurpose work of male and female. Srivastav committee talked about the semi-professional and the semi-professional and the para-professional merging over there, right? So one point you should remember about this one. For example, Modular committee, they have talked about the strengthening of the PHC, subdivisional hospital and the district hospital and all of those things, right? So that was about the planning, health planning and the management, where we have talked about the planning and the management. We have talked about the objectives, we have talked about the target and the goals, right? Usually objectives are short term and the goals are long term, right? And finally we had to talk about the different kinds of committees. So all the best for your exams. I will see you in the next one. Thank you.